The Delta State government has released 1 billion naira to the Delta State Contributory Health Commission to improve the finances, operational efficiency, and access to health care by enrollees of the Delta State Contributory Health Scheme. The Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr Isaac Akpoveta, disclosed this during the enrollment of 150 vulnerable people in Onicha-Uku, whose premium of 7,000 naira each was paid by a Delta philanthropist based abroad. According to Dr Akpoveta, the Delta State government released 1 billion naira has been disbursed to 531 health facilities operating under the scheme spread across the 25 local government areas of the state.
If you visit hospitals in Delta now, you find everywhere renovated, equipment are in place. Recently I've gone around to all the medical zones. There are 11 medical zones in Delta State, and I've been talking to them about quality care, efficient, effective care of the enrollees into the scheme, and they are buying keen into it very seriously. His Excellency is also very happy with this program. He has approved and released 1 billion for the payment of health care for under 5 children and pregnant women across the state. This money has been paid to the hospitals only last week. So we have infused 1 billion into the healthcare system for insurance. So any pregnant woman in the state, please, as soon as you are pregnant, go and register and get a health card. With that health card, you receive free antenatal, free delivery, either by spontaneous delivery or by cesarean section. The government is paying for it. And so you don't need to suffer financial difficulty in getting that. Then that child, from the very first day of birth till the child is 5 years, you saw a baby of Sheriff, the governor. He has already deposited money for all these children. So all you need to do is register them and get a health card. With the health card, you attend a clinic of your choice, government hospital, private hospital. You receive treatment free of charge.
Dr Akpoveta appreciated the abroad-based benefactor for the gesture and called on well-to-do deltans, both home and abroad, to emulate the abroad-based philanthropies and enroll vulnerable people into the state health insurance scheme.
This commission is basically to ensure that all deltans of all levels are registered into the scheme. And then, of course, we brought in an initiative for the vulnerable people, vulnerable resident deltans, to be adopted and registered into the scheme. Was a clarion call by this commission to people of goodwill, philanthropists, organizations, to buy insurance for the less privileged. And today I'm a very happy man, for the fact that this clarion call has been taken up not only even in Nigeria here alone. Our brothers in the diaspora, in America, in Britain, are buying insurance, sending money home to register a lot of their people. For example, today, Governor Lumelu of Onicha-Uku, sent money home to register 150 resident deltans of the venerable group into the scheme. That's a very, very big step of this initiative. People living so far away, remembering home and sending money home. So we're very happy that he has done, Governor Lumelu has done this, a US-based philanthropist, entrepreneur, and sending money home. We'll use this opportunity again to re-echo the call. And wherever you are, the best gift you can give to any human being is his health. If you give him food and he's sick, he won't eat the food. But if you give him health, he can do anything for himself. Health become wealth. So we must tell deltans in Delta, the diaspora, both in Nigeria and across the world, to remember home, that some of us here need help. Help not to buy food, but to get good health. And we're only asking for 7,000 naira as a premium for a year. And so you can buy insurance for as many people as possible. So once more, I call all Nigerians diaspora, deltans in particular, to kindly continue to purchase health insurance for their people so that they can receive quality health care.
Speaking on the behalf of the abroad-based philanthropist, Paul Elimelu revealed that most people in Onicha-Uku find it difficult to pay their health bills, and that is what prompted the enrollment of the 150 people into the Delta State Contributory Health Scheme.
I came in respect of this health insurance scheme, which Godwin Elulelu has come to present and to take care of the entire people of this Onicha-Uku community. We are indeed very, very grateful for him initiating this idea, and also grateful to our governor who made this possible. We also appreciate the entire people of our community who has come in respect of this healthcare scheme. So we want to thank all members that are present here, the representative of the state government, of the health sector, that made it possible for us to enroll on this health scheme. Okay, what really motivated Godwin Elumelu was that he came to discover that it is a very big challenge for entire people of this community on this health issue, finding it difficult to access health because of the running costs. So hence he decided not to say no, let him invest on health care delivery.
And on behalf of the sponsor, our own illustrious son and brother, Mr. Contributory, I present this health card to you, Mama.
Oh, look up.
Go and assess care. Anytime there's a health condition, just take it to the health facility and present for access to care.
On behalf of the Elumelu's family, I present this card to Mr. Larry Igbenoma.
In fact, it is now that something like health is being taken very seriously in the area here. And it's not common. This is the first time somebody is undertaking health in this place. So first of all, I want to appreciate on behalf of myself and President General and the entire community to thank Mr. Godwin Elumelu. I want to read out Godwin Elumelu to this speech from Honorable Godwin. This is Godwin Elumelu, not mistaken. So I'm thanking him very much for what he's done. And equally thanking the governor of Delta State. As he's reaching out to us. As the President General, we met him several times. I said he wants to reach out to all Deltans. And he's not making mistakes. So I want to send to, on behalf of to thank our governor, Governor Sheriff Oberewere, for making us such a big amount of money for health, in spite of all he's doing. And I want to say that none of the Delta governors has ever let us down. Please clap for governors of Delta State. Thank you very much. Take a message to him. And I will also that he increased his tempo and his contribution, that we are all behind him.
In good health.
It's family second time.
In good health.
Let me assure that Onicha-Uku community is for the governor for the second time.
The medical director, General Hospital Onicha-Uku, Dr. Chukwuma David, revealed that the released funds have gotten medical personnel more prepared to deliver quality health care to subscribers of the scheme.
Say this is a very great innovation and initiative engaged by Mr. Godwin Elumelu. Accessing health has been an issue for the people in the rural area, you know, in terms of finance. So it has always been an issue that we always have to deal with in an environment like this. Bringing this health insurance to the people and in their localities will help and enable us to deliver health with optimal precision and improved level of care to the people in this environment. And I also want to thank the Honorable Governor of Delta State, His Excellency Honorable Sheriff, for what he has done in this scheme. The category, that is the under 5 and the free care for pregnant women, they have all been benefiting. Our facility is up to the task. We have a range of services which we can offer to them at the level as a secondary care facility. And there's also a provision in the scheme If there are cases that cannot be handled by this facility, there's a provision to be referred to say tertiary facilities where no, this is secondary, so to a tertiary facility where they can be cared for, still under the coverage of the scheme. So no fear, whatever it is, let them come in. We are ready and we are prepared to handle everything.
Our Oga, when they here, go present this award of health insurance ambassador. It means say when Oga Godwin write his name, he go write HIA after his name as health insurance ambassador, which recognize given by the Delta State government and recognized the world over.
On behalf of Delta State Contributory Health Commission, we hereby present this Health Insurance Award to Mr. Godwin Elumelu.
The enrollees of the health scheme are optimistic that the released funds will go a long way to give them improved access to quality medical care.